Welcome back to another episode of the Gaslit Truth Podcast. I
Mhm.
am one of your hosts, Dr. Teralyn. I'm here with the other host, Therapist Jenn.
Hi,
Hello. Hey,
hi.
hey.
Hi, hi.
Uh, Today's episode is personal, right? It's
Yes.
personal for us both. And I still am so excited to talk about these personal things with someone else who has had very similar lived personal experiences because sometimes we sit and we think that nobody else knows, or you get so gaslit in thinking that you're the only one or that didn't even
Mhm.
happen to you.
Yes.
So it's always wonderful, especially another professional. And Jen and I didn't really realize how similar things were for us personally. Professionally, yes, we have very similar backgrounds and current situations, but even personally things are very similar. And so today we're going to be talking about antidepressant use in pregnancy.
Yes, we
Uh,
are.
yes, we are. And this is personal, and we're going to bring in some research and just some conversation because it is a profound discussion that is still not happening in doctors' offices. And
Yes.
yeah, so where would you like to begin, Jen? Because I know this is like,
This one is hard. This one is
it
tough. You know what? Okay, so let's take a let's do a little bit backwards of approach of it, and let's talk a little bit about what you and I have when it comes to some of the. So let's do some of the research or some of that stuff maybe
Sure.
first, because I kind of want to just dive into like sharing the story. But you know what? Maybe I feel like if we do that, I mean, I also want to bring people just a little bit of other knowledge that isn't just us and our opinion, right?
Right.
And I have a feeling if we get going, we might not get to it because
Right.
this one pulls on our heartstrings, right? Because
It really does.
we lived this one. So let's start with that first, and
Okay.
then maybe let's go to does that work?
That's great. I do wanna start a little disclaimer, because
Yeah.
if you are currently pregnant and you're on an antidepressant, in no way is this meant to shame you, to devalue your experience, and also, please do not go off cold turkey. So, what you might wanna do is just have some open discussions, with your doctor about this particular topic and maybe what to expect after your infant is born. I think those are the conversations to have. So don't let this scare you. This is some research, and these are also personal experiences of
Yes.
ours. But we also want you to know that every experience is a valid one. All right. So with
Yeah.
with that, we're going to go into some scary research. The
Yeah.
research is not good, and it's
Mm.
really interesting because so many people get prescribed right before pregnancy or even during pregnancy
Yeah.
of antidepressants, particularly Zoloft. And the research is not good with fetal outcomes.
Right.
Okay. So,
Right.
this is the balance between, fetal outcome and mom outcome, right?
Right.
Like, so
It
this
is.
is,
It's both, right? We have
yes.
to look at both of these when we're talking about this because there are two sides to this coin, right? So you have
Mhm.
to worry about the health of the fetus itself, right? And we also have to have that conversation about the mom's stability as well.
Right.
Um and and I like that you gave this disclaimer, Terry, at the beginning too, because there are risks if you are a mom, you're pregnant, and you decide that you don't want to be on these medications, right? Like that in itself is a risk too, when you're in that state of pregnancy of what it means to go off of a medication, even
Right.
with what happens when you have withdrawal effects, because those are going to impact you and baby, right? So there's so
Yep.
many different things to consider. But what we do know from some of this research, right, is um, pregnant moms, right? That specifically now I've got some general stuff on SSRIs, SNRIs, okay.
Yes, please.
Um, but it's more about this idea that the research shows that there is more spontaneous abortions,
Oh,
okay,
interesting. Mhm.
or some more increased numbers of stillbirths that occur, okay, or going through treatments within the third trimester of pregnancy, these SSRI, SNRI treatments, right? And you're taking that are more closely linked to like some like neonatal adaptation issues, right? And so that's a whole separate thing to get into and what that means. But that's your muscle tone, respiratory difficulties, all those pieces, right, for the baby, right? So,
Yeah, well,
um,
and plus the longer term outcomes that you won't know until your child hits probably kindergarten, 1st grade, when you're
right.
looking at behavioral issues, you're looking at language processing issues, things like
Yes.
that are also
Yes.
very well researched, which
Yes.
brings me we'll get to some of this conversation as we go. This is a
Yeah.
deep conversation. We're gonna try to do the most respectful job that we can,
Absolutely.
knowing that nobody likes to talk about this,
They
right?
they don't, and who would want to, and so what I'm talking about, in some of the research that I've looked at here is it's from 2018, right? So what I'm gonna talk about, what we'll put in our notes right here, is
Mhm,
from then. However, what person, what mom, because I was here. So when we get into our stories, I was here, wants to even think about the idea that their newborn, right, who is
mhm,
exposed to like an SSRI or an SNRI, right?
mhm,
That they could require longer hospitalizations. They could require more tube feeding. They could
mhm,
require more breathing, right? Support for breath, right?
mhm.
And some of those like more toxic effects of SSRIs or SNRIs, right? Like that is the withdrawal piece too. So
Mhm.
that's the other piece that we also have to bring into, and not for the mom, but even for the baby,
Right,
because
and
everything that mom takes during pregnancy does impact child, right?
which
It's no
leads me down to this conversation,
yeah,
especially moms of today. So the last baby I had is now 22 and a half years old, okay? So my experience with this is 22 years old, which is weird to me because I know some pregnant women today who go into the doctor and they've asked about SSRI use with pregnancy, and the doctor goes, "No problems." And I'm like, that is just simply untrue, you
yeah,
know?
that's
That's
my
not
story.
yeah, that's not informed
That was my
consent
story 12
whatsoever.
years ago. Don't worry,
Right.
Jen. It's
But it's
fine.
funny because it'll be like, "Yeah, oh, SSRI use or SNRIs, no problem, but here's a list of foods that you need to stay away from." Like this long list
Don't
of
eat the deli ham,
yeah,
damn it.
deli meats, tuna, whatever. I don't
Yeah,
even know what's on
honey.
that low.
Yeah, it's all
For
kinds of
me,
things.
22 years ago, it was caffeinated
Yeah.
beverages, dark sodas. I think those
Yep.
were the 2 big maybe deli meat and tuna mercury, right? The
Yep.
mercury from tuna.
Yep.
I think that was pretty much
Biggies.
it 22 years ago, But it's
Yeah.
so fascinating to me that they can offer these giant lists, like, in the doctor's offices, give you the list of things that you shall not put in your mouth,
Yeah.
but tell you to your face that something that alters your chemistry is fine. There's nothing to see here. I just feel like that is the worst thing that you could do to a mom, to a new mom, because I know the moment that I got pregnant, I was worried about everything. I was
Mhm.
worried
Oh,
about what I put in my body. I was
everything.
worried about it all. Like mom guilt happened the moment I saw the positive pregnancy test.
Yeah.
Suddenly, I wasn't a good mom just for no
Yeah.
reason. Like
Well,
like
everything mattered in a different way then, right? Yeah,
yes.
everything
Yes.
changed.
But
I and
how can a physician who's prescribing this or whatever look you straight in the eyes and say, "There's no problem, nothing to think about here, nothing to have concern over." How can they do that? I don't
yeah.
understand,
Well,
and because I think there's the other side is fear, right? Well, I don't want to scare you into not taking it, and then I go back into these conversations about, why are you assuming that I will be so afraid that I'm not gonna take it? I wanna know, I want knowledge, I wanna understand what some
yeah.
potential outcomes are so we can plan for them.
Yeah.
Right? Like, yeah,
You
I
you
think
gotta
I
throw your other thing in there that you say a lot, Terry, which I think matters too, into this manipulation into compliance,
yeah,
which is what
yes,
we call it, right? Okay, this is a,
yes,
a terminology we've used, which was, you know, Jen, what's gonna happen to you if you
right,
go off of these? there's no the baby is gonna be fine, like, and that was my story,
Which is
right?
not necessarily the truth
Right,
either,
baby will be
right?
fine, you can be on
Yep,
these medications, and you
but
don't
don't
need
eat
to
deli
worry.
meat.
Yeah,
Mhm,
don't eat honey or deli meat, because that's just, that's gonna really that's just really gonna fuck your kid up, right? You're gonna have 11 toes there with that one. But it was this whole idea, like, of so that mattered, and I glommed onto that, right? But I remember hearing this manipulation of compliance piece, which was, what's gonna happen though, Jen, when you think about you? If you go off of these meds, okay, like, what is gonna happen to you? Because you do not wanna be back in that ultra depressed state
yes.
that you were in when you started this
Basically,
med.
you're gonna go off the rails
Correct,
and,
and so I was like, "That makes sense." Yeah,
yeah, oh,
absolutely,
yeah,
right? Like,
it
that makes sense. So
does.
if the baby's fine, and I know nothing's gonna be wrong,
Mhm,
there's no residual impacts on my children, then I need to stay in a good mental health space too, you know?
mhm,
Now, fast forward, even though I never had, even with my second child, not like I had bad postpartum depression,
mhm.
with the first one.
I
None of
did,
that.
but
Yeah,
mhm, we'll get
none
there.
of that, and so
Mhm,
it was just like, "Yeah, you better remember what happens," and I'm like, "Okay, yeah, we stay on this then," right? So
right.
I felt in that moment, I felt informed enough, safe enough, um, and I took that at face
Scared
value.
enough?
Yeah, I took it at face value. I did, and I went, "Gosh, Jen, yeah, she's right, because if I go off this med, remember what happened when you started this 10 years ago? You were a
Right.
mess. I can't be a mom like that." And so those words, the words that we use with our
Words
patients,
matter. They
gosh, they
matter
matter
so much.
they matter so, so
So
much, and we
much.
believe it, like, our clients too, it's like what we are saying to them is the holy grail of something, and I'm always like, "Please don't. Do not
Yes.
put me on that pedestal."
Well,
The
it's the
thing
position of power that
it
we are
is.
in, that other
It
people are in. I hear this
is.
a lot, and I heard it more when I was in private practice than when I worked in the prison system, but I still
Yeah.
hear it, like, I'll have clients say things like a lot of them, "I heard your voice inside my head telling me, blah, 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 think about this, think about that," and to me, I'm like, "Oh, wow, you're actually listening." That was number 1. You're actually listening, you're hearing what we're talking about.
Yeah.
Number 2, I was like, "Wow, my words are powerful."
Yeah.
Like, my words are powerful to
They
people.
matter.
They
Yep, they
matter
matter so
so
much,
much,
and we
and I
take
think
those words.
yes, and I think as clinicians, as practitioners who hold a position of power over clients, because we do, I think we forget how much our words actually matter.
Mhm.
And when it comes to pregnancy, like, this is the most vulnerable time of a woman's life,
Yes.
and we wanna make sure we're doing everything right, which is an impossibility, by the way. But we wanna make sure that we're doing that, especially if you're a first-time mom. Oh my gosh, like,
Mhm.
all of those things, and so when we go to the doctor, we wanna believe you. We want to believe this, and this brings me back to actually my very first pregnancy, which is now 28 years ago. So it reminds me of this, when that was early stages of HIV testing, okay? So
Okay.
now I believe they just do it as part of a panel, like it's just one of the things. Then it was, you could do it if you wanted to, okay? Like, it was
Okay.
one of those things, it was new, right? This was 1995. And so this type of screening in pregnancy was a new thing, right? And I remember thinking, well, damn, I've been a whore before, so I don't know what's gonna happen, like, I'm just kidding. Like, I was really worried. I was scared because at that time too, we're coming off the
Yeah.
'80s. People were very afraid of HIV/AIDS, which is now
Yep.
it's still possibility in the case, but, the treatment for that is very different. It never dawned on me as being a possibility until my OB brought it to my attention, and she's like, "We should test you for this," and I was like, "What if I have it?" And then I
Mhm.
actually said to her, I said, "I don't wanna know if I have it, we'll just wait and see until the baby's born." And she said to me, she goes, "I want you to know if you have it or not, because then we can plan for potential outcomes." And that's the
Mm.
thing that I'm bringing forward in this conversation, because I would have want to know what some of the problems that could happen would be after birth, and how are you gonna know if everyone is just dismissing the idea
Yes.
that nothing bad is going to happen? And so
Yeah.
that's how I don't know if that made sense to tie that all together, but that's what it makes me think about. And that I really commend her, and again, this was 28 years ago. that was informed consent. Like, she was talking
Yes.
to me about, like, "If you do this,
Yep.
this is what we're gonna know from it, and this is how we can respond to your infant as a result, and to you as a result." Informed consent is not, "Oh, you'll be fine," you know,
Mhm.
or, mom guilting you into not talking about it anymore, or not getting curious about it, you know?
Mhm.
So I had a little bit of research to share with you. This was profound to me, and then we'll tie it into some personal stories here too. So this is a study in psychological medicine, and this was done in 2022. Um, that babies born to mothers taking antidepressants were more than 6 times as likely to have neonatal withdrawal symptoms, including breathing problems, irritability, agitation, tremors, feeding problems, and seizures than those born to mothers taking other types of drugs.
Yeah.
More than 80% of the reported symptoms were classified as serious. Um, this is important to me, and these conversations make me so personally sad. Like, they make me very, very sad, and
Yeah.
I think about the amount of women who are prescribed these classifications of medication and who are delivering babies while under the influence of these medications.
Yeah.
And then I think about all the rates of kids in schools that have learning problems, development problems, behavioral
Yeah.
problems.
Yeah.
I'm not saying that there's a correlation, but I wish somebody would look into it,
Eh,
because I don't
yeah.
see research on that, and how can it not be there? Like, how can this not be a thing, you know?
Well, you're and I have a so you're bringing that research. I have something to tie into what you're saying,
Mhm,
which is very frustrating as a mom, not only a mom, but like a consumer of someone who had 2 children, taking an SSRI, okay? At its most simplest form, okay? When we look at the idea of a drug such as this, it passes through the placental barrier. Okay, it does that blood-brain barrier. Okay, which
mhm,
passes also onto like our breast milk, right? So when you're talking about kids, right, like even older children, right, and like our kids that are going through all of these struggles with all those things that you just listed off, right? I think about this idea of I not only myself, how simple of an idea to know that that whole time that drug passes that barrier. So I was always giving and feeding something of that, right, while the child was growing. But then even afterwards, when I was breastfeeding my children, that all passes through that blood brain barrier, right, into the
mhm,
breast milk. And so like we think of like the increased level of like monoamines, right, that are in the fetus that affects like how the brain matures, right? And
mhm.
then we look at that in terms of the breast milk that we're giving. And I'm sitting here and I'm going at the most simplistic level. And I don't know if anybody else feels this way, but I'm pissed at myself almost a little bit for not getting more curious. Just a little bit, right? I
Yeah,
really am because it's so simple. I mean, like this is where like science, like it's science, right? It really, this is not that hard. And so I'm I'm mad at myself, and I'm also mad at providers along the way who did not just say that, Jen. Like, just so you know, this is what actually happens. It's real simple. When you take this drug, this is how what it does. Does it going to pass through that placenta? Yeah, it
yeah,
is. Yes, Jen, it's going
yep,
to because
mhm.
that's what it does. And give me a 5-minute explanation of this so I could
Of
really
what
kind of
that
what
means.
does that mean then? Yeah,
Yep,
because I didn't and I so I'm my anger is directed right inward to it myself because, hindsight's always 2020, right? And I'm never going to sit here and say that my physicians were trying to be volitional in any way, shape, or form. So I
no,
don't want people to think that either. But boy, when I
but
sit and look
then
at
I
this,
do have
like
to say, Jen, like, but this research that we're talking about is not 1 or 2 studies.
I know,
This
it's
research
not.
is
You're right.
multiple studies across multiple journals, and they're still saying nothing to see here
Yeah,
often. in
Off
offices today. Now,
yeah,
20
yeah, they
some
are.
years ago, I could see,
Yeah.
because it was new-ish,
Oh,
but
yeah.
I do wanna bring this in too because when I had my son, so I talk about this in our last episode, um, I think it was the last episode, I don't know, I talk about this a lot, but
You
anyway,
brought it up a few
so
times.
yes, I talk about it a lot because when I was prescribed first, antidepressant, it was preventative, okay? Because I had had postpartum depression with my first child, this was prevented in the late 2nd trimester, early 3rd trimester. Okay, so that's how the setup happened for me. I wasn't even depressed, they were trying to stop me from being depressed, which
Yep.
is really fucking weird if you think about it today,
It
but
doesn't make any sense. I'm trying to understand it.
it makes no sense to
I
me
really try to get to the
today.
truth to understand
Yeah.
something, and, like,
Said they should have
that one is
resourced me or something. This is
something,
well
but
before I was even thinking about being a therapist, by the way. Like, I had no idea. I didn't know what I didn't know, but anyway, it was freaking weird. Anyhow, so I got this, and when my son was born, a couple of things happened. The first, he had an ear defect, okay? And again, there's no genetic history of ear deformities, microtia of the ear, any of that stuff in our families. So it's like, this is weird, that this happened. The second thing that happened, and I blamed myself, was that he could not feed. He was a very sluggish feeder, which means that he became dehydrated within the first few weeks of his life, and they
yeah.
almost hospitalized him due to malnourishment and dehydration. And I blamed myself. I was going to all the lactation specialists. Like we were going there every other day.
Mhm.
I was pumping. I was doing all the things. I couldn't produce milk because he wasn't drinking it. He wasn't because he was too sluggish to do it.
Yeah.
Looking back on that, I now know that he was probably in withdrawal, neonatal withdrawal from my SSRIs that I took because
Yeah.
it is classic withdrawal symptoms
It
here.
is. It is.
And I'm like, "Oh my lord," like, if someone would have told me that though, like, if someone would have said as a preventative, if they would have said, "Hey, but this is what could happen," I'd be like, "You know what? It's a preventative. I'm not just let's roll the dice on this one. Let's not get
Yeah.
started." If even still, if they would have said, "These are the things to look out for later," I would have known to look out for it, right? But I didn't know. I had no idea. And so, of course, I blamed myself. I'm like, this
Mhm.
was my second child. Breastfeeding didn't go very well the first time. And I was like ready for it. I was like, I'm going to do it. I set it all up. Like, and it still was a miserable me failure
Yes.
in my mind.
Yes.
But I really do believe now that it was a result of neonatal
Mhm.
withdrawal. And nobody's gonna validate that for me except for me, you
Yeah.
know? And then fast forward, he ended up having some language processing problems when he was younger, and, of course, the school wanted to put him on ADHD meds and all this crap until I dug deeper, and it was a language processing issue.
Yeah.
So special supports for that, and I'm like again, looking back, I'm like, "God damn." If somebody would
Mhm.
have told me all of this stuff could have happened, and then I believe that it actually could happen, not, it's so rare, like, all of that stupid manipulation at the same time. It's so rare, all this stuff. I'm like, rare doesn't mean it won't happen. Like, I guess I have trouble understanding
Yeah.
how something can impact, an infant so profoundly, and we just dismiss it, you know, as if, "Well, it's rare enough that you shouldn't worry about it." I'm like,
Mhm.
I in what other scenario do we say that? Like, I just don't
Yeah.
even know, like so, anyway, he's doing great now, just so you guys
Yeah,
all
yeah.
know, like, he's doing so well, like, he's doing so well, it's incredible, but, that's the story of that, and to me, it all makes perfect sense
Yeah.
when I read the literature on this, and
Mm.
again, I don't fault anybody at this time because this was, 23 years ago, essentially, when this was happening for me, but yet these conversations are still not occurring, you
So,
know?
that's the piece I was gonna slide into. So I myself, right, mine was 10 years ago, right, 12 years ago.
Mhm.
But the conversation did not happen for me that way either. It was more of the, manipulation into compliance, which is what we called it, right? It was, no,
Mhm.
there's nothing wrong with this. And if you'd stop, think about what could the impacts
Right.
be on you and the baby if you would even think about titrating off of your medications, right? Like, so that scared me, thinking, yeah, you're right. My God, I gotta be an on the Johnny on the spot pregnant woman and mom. So I
Mm.
need all that. I need all that, right? So, but the other thing that is really disheartening, and I am sure, I am hoping, I am certain that when people listen to this episode, moms out there, you will be able to validate this truth for some of us, which is even today yet, that's still the conversation happening. So, okay, yeah, 20 years ago, fine, 10 years ago, fine for me, but today, it's
Yeah.
still happening. And I have a couple individuals, even personally in my life, that are going through it right now and have shared with me what was said to them. And I just sit there and look and I go, how is that? How is this part of the conversation still? All these pieces matter. Like, at what point do we start to get inquisitive? And thank goodness for people who are more empowered patients in their inquisition, right? And
Yep.
start to ask more questions, because I didn't, right? Which I didn't. And but thank goodness for some people that can do that now, and for people who will, I know, are going to hear this and give us feedback and respond to this and say, yeah, this was my story, this is what I was told, right? This is what I'm struggling with.
Yes.
And here we have intergenerational, like, it's intergenerational. Like, my mother said the same thing to me. This, you go through this, not that you're my mom's age, but I mean, we're
It could
close.
be.
Yeah, I'm close.
It's close.
Right. And then I've had conversations with her about this. And then I went through it. And now I've got friends that are much younger than me, right? Having children now. And they're going through it. And I'm going,
It's
what
the
the hell?
same
What is,
thing.
like, did she really say that? Or are you guys making shit up? Cause I'm on this like whole like and my some of my close friends, nope, Jen, this is what was said to me. And I'm like, oh gosh. What? Okay, let's here. I'll just feed you a little bit. You just take this information, do with it whatever the hell you want. I don't care, because I'm not going to try to throw my judgments on you. I'm just going to give you information. Give yourself the benefit to ask questions and be inquisitive, is all I'm saying. And you can make your choice however you want. But
Yes.
wow, so it's still
Well,
happening.
and I think, yes, it is still
40
happening.
years worth of like, just like, these are personal examples, right? But like, we can look at the research too. What I'm pulling up is from 2018. What you're pulling up is from this last year. How is
Yeah.
this it's here. It's
It's
real.
here.
Within.
And I think about it like, particularly OBGYNs, right? Like, they should be on top of this because they're the ones dealing with pregnant
It's true.
moms. I feel like they are the ones that should know, and they are the ones that should not dismiss. And they are you can have
Mm-hmm.
hard conversations that aren't scary, right? You can have those. They're quiet conversations, but they are literally risk benefit alternative. That is what informed consent is, right? Now, I mean, you bring it in and you have a mom that's been on this for a long time, like that conversation is very different,
Correct.
very different.
And it needs to be, but
It
they need to be able
right.
to know why that conversation is different, right? Like,
But I
here's
wish what
what
I
could
wish would
happen.
happen, is um doctors when they see someone of childbearing years should
Yeah.
be asking them, like, "Are you planning on having a child within the next year or 2, or planning on getting pregnant in the next year or 2?" Now,
Yeah.
obviously, that's not a fail-safe thing,
Right.
but then the conversation should start happening because you're taking these medications, and we might consider a taper plan, you know what I mean, to get you in a good physical state to give
Mm-hmm.
birth, right?
Right.
But that's not happening either,
Right.
and I feel like it should.
Mm-hmm.
So it's just
Yeah, that begs the question too about this whole, like, you know, any professional with a license, right? We have all
Mhm.
of these CMEs, right, that we have to take, right? And all of
Yeah.
these for our credentials, right? There's so many hours that we've, we've got to have in continuing education. And it really, I always thought about this, especially the last couple of years. I've really thought about the idea of what it is that those continuing education hours actually are for some of these professions, right? So if you take someone who is an OBGYN, right? And there's options for trainings, right? They've got their ethics training that they're going to have to do, and there's different things within that field that they do. And I've got a dear friend of mine that is an OBGYN, right? And I would say, like, so what about this idea of a ton of your education and training, continuous training, going into this idea, like this whole idea of let's do a little bit more education for this. Like, this is where sometimes I think our field fails us, because I think we should be able to give certain areas of education to certain professions that don't have as much of a lens in it, because they're not as much of an expert in it, right? Like, and so that they can have more information on it to be able to give to their patients. So when it comes to informed consent, right? Yes, you know a lot about meds, but you also know what there really truly is to what does it do to the body? What does it do to the baby? What is it going to do if you do a taper plan? What are resources you might need outside of just yourself, because you're probably not an expert on a taper plan, right?
No.
Like, right. And so that idea of education, right? And being able, so I think sometimes the field fails them too. When I think about how our doctors are also are failed in some ways too. They're not resourced with that information, but yet they are the hub. They're the first. You're the hub. You're the start. You're the
Right.
high. I'm doing the exams as a gyno, and you're with all these women, hundreds of women every single week, talking about, are you in that space to have a baby? Are you interested? Maybe
Yes.
you're pregnant already. Like, why don't we resource the shit out of these OBs then?
It's a
You know
fair
what I mean?
question. Well, they do. The pharmaceutical companies resource them.
Yeah, they get resourced by, yes, they get resourced by many things, right? So there's the
Right.
medical
Maybe you and
model
I should
piece,
be doing that. Like, let's
right?
go
But
start
like,
that.
right, but really, truly, right? Like, here's all of these things that you do, and ECCs, you take in all these trainings and everything. Like, so let's resource you in the things that maybe you're not the expert in, right? Okay, which is fine. You don't have to be the expert, but you need to have enough information to be able to give your patients enough, informed consent so they can make a decision. But if
Well,
you don't have
that's
it,
just it, because I think many patients, you can't make an informed decision if you only have one way of looking at something.
right,
So,
right.
people argue with me on the internet all the time, and they're like,
Yeah, they do.
"Well, you can." Yeah, you're like, "Yeah, they do."
They do.
You can go on Google and find that out yourself, and I'm like,
Yeah.
"Well, you can,
Mhm.
but that's not informed consent. Informed consent comes from the provider. Like,
Right.
it is their legal responsibility to give you informed consent about
Yep.
anything that they're
Mhm.
doing, right?
Yeah.
That's their responsibility for you. And that informed consent is risks, benefits, alternatives. That's what
Mhm.
full informed consent is. It's not you going home and searching on Google what the potential
Mhm.
risks, benefits, and alternatives are. Now, you can do that for sure, but
Yes.
informed consent also doesn't happen at the pharmacy level. Like, people are like, "Well, at the pharmacy, you get a big list." I'm like, "Yeah, that's after you've been prescribed."
Right.
Like,
Mhm.
that's like
I get it every month.
yes,
It's right in the little
exactly.
bag. It comes right
Yes.
in. Here you
And
go. Like,
sometimes it's not. I mean, I go through compounding pharmacies and they don't have those
oh, they
things
don't
because
even
it's
send it. Yeah. Yeah.
no,
Yeah.
So, I mean, sometimes it's not even there, but I just think, like, it is still the provider's responsibility to provide informed consent for their
Mhm.
clients, and that doesn't mean something hanging on the wall, that doesn't mean all these things, but I think in our fast-paced medical system that we have, to be fair, and I'm giving them a little bit of an out, like, they're so behind. Many
Mhm.
physicians are so far behind daily is what I'm talking about, like,
Right.
running behind, having so
Yes.
many people in and out, running behind, that
Mhm.
there is just not time to
Yeah.
spend to do all those
Yes.
things,
And
you
I
know?
think that's a fair, and you're saying an out, but I also think that that's fair too, because that when I say they're not resourced enough, right? Like
Mhm.
that in and of itself, right? When we talk about the average patient doctor visit in the United States being about 7.5 to 8 minutes, right? That really, that reigns, that just feels sick to me when I hear that, because we are taking professionals, these providers who are this wealth of knowledge, who are doing good, who are in this profession. Most of them are not there to be evil, right?
Right.
They came into this to help people.
Mhm.
And yet, here are the resources as a system, right? We're going to give you. Here's your 15 minutes. Here's your 8 with your patient. You've got 4 or 5 minutes to do your dictation. eat a sandwich, move on to the next. Wash, rinse, repeat, do it again. And so
Right.
their resources, the ability to sit down and have that kind of conversation with a patient, oh my goodness. Right. And here's the other thing. Let's bring insurance into this now.
Right.
And when the insurance company, we get this too. Jen,
Yes.
Terry, here's how many minutes you get to bill that code so that your patient can receive the service. So
Yep.
I don't actually think it's an out, because I think, to be fair, like, I this is the other truth to this for all these providers. If you don't know this, everyone listening, there are so many rules we must follow
Mhm.
just to get our patients care. And
Yep.
if we don't follow those rules, guess what? Insurance is not going to reimburse them. They are going to be stuck not getting a service because they can't afford it.
Right.
There's so many holes to this. So here are these doctors who, to have a real conversation on risk and benefit and all these things, you need more than 7.5 fucking minutes.
Yes.
I mean, let's look at that too. So any doctor you go to, their schedule is every 15 to 20. There's another patient,
Mhm.
another patient, another patient.
Yep.
Think about that process, that it and what that does. And that's a systems issue. That is such a big, huge piece to it, but that matters too. And so then you're stuck with that. We have it too. I would love to
Mhm.
spend more time with patients, but guess what? This is
Mhm.
the amount of time that I'm allotted, and your insurance is not going to pay for this.
Right. Right.
It is,
It's just
so
this is these are fascinating conversations, but
they are.
I still wanna bring back the idea that I'm curious about,
Yeah.
the long-term impact on kids in our schools and what school districts are seeing right now,
Mhm.
as far as, behavioral issues and learning problems, and we're seeing this like never before.
Right. Right.
Never before. There are never enough resources in a school. There are more and more kids that need IEPs or 504 plans and
Yep.
all of the stuff. And, it's funny because like as a mom who has been sitting in, principal's offices and planning for my kid over and over and over again. Yes. Um
Hi.
there's very much still a culture of this is a parenting problem,
Oh, jeez.
right, and I'm like, "Yes,"
Oh,
but
yeah.
physiologically, I mean, I sat in so many meetings and one of them, it was I think his reading teacher said, "He's a sad and angry child," and I went, "What? Say what?" And
Mm.
I in my mind, that's what I said. In the meeting, I said, "Well, maybe it's school." Because he has a hard time learning,
Uh-huh.
right? So but
Yeah.
at home, he's a very happy-go-lucky kid because
Yeah.
he can be a kid. And
Yeah.
so basically, like, I was like, "You can't categorize my child like that. It's
Yeah.
a learning issue." But then I go back to, like, how many other kids have these learning issues because of lack of informed consent during
Mhm.
pregnancy?
Yeah.
And I just think it's something to be super curious about.
Mhm. Yeah.
And it's not in any way, shape, or form a blame or shame game of a mom because we were both moms who did it too, right?
We
Like,
did. We
we
did.
did.
Yep.
And
Yep.
I just again, mine was so long ago that the research wasn't the way that it is now for anybody to really
Mhm.
know.
Mhm.
But now to me, there's, like, no excuse to not know. Not as a mom, as a
Yeah.
practitioner. There's no excuse to not know as a practitioner what the outcomes could potentially be.
I had a very recently had a conversation with a very, very good friend of mine, and somehow we got onto talking about, breastfeeding, okay?
Mhm.
And, our children are all older, right? And we're out of that phase of this. And we were talking about this idea because our stories are very similar in terms of medications that we are taking, we're taking, have been taking, right? And it was a little bit of a dive for just a hot second into looking up some research on the impacts of an SSRI or an SNRI on a mom's ability to burst milk and to
Oh,
lactate, right?
interesting, very interesting. Yeah,
Yep.
that's
And
same
I was
thing.
and I'm looking at it and I'm just like reading a few things, and I didn't get too far into it. And I'm thinking about my experience, and I'm thinking about her experience and how similar they were. Hers was a little worse than mine. But the inability for us to be able to even produce milk for our children, right? And when you start to look at some of the hormonal implications that
Yes.
occur from some of these medications, and I'm looking at this going, wow. And I mean, talk about the distress that that creates for moms, right? So the hours of crying and with the boob ladies, right? And like
Oh,
trying everything under the sun. The girl who hates beer, I'm drinking beer because this is going to help. Beer's going to stimulate this, right? All the products I bought, the creams, the gels, I mean, I was touching myself in ways that were really uncomfortable to try to produce some milk for my children, right? And I just remember being so defeated, Terry,
yes.
sitting
Mhm,
and crying and crying. And I was so incredibly defeated as a mom, even the second time around. And I had prepared myself like, okay, we're going to do more formula, and that's okay, right? Like,
mhm.
that's okay. Even though this may have very well, some of this came from the fact that I'm medicated with something that's not letting me produce milk, right? But
Yes.
no, I'm the problem. So therefore, we'll bring formula in, which is fine. So I did that, right? And I remember just like having to be okay with something that bothered me so much, which was I can't actually give just breast milk to my child.
Right.
Sitting in a spot going, I have to be okay with the fact that something's wrong with me. And
Mhm.
oh God, it just fucking
I
hurts.
I
It
know,
hurts. It like
I know.
hurts when
It hurts
I'm
now to
going back in
talk
my
about.
mind and I'm
Yes.
feeling like I'm getting a little teary because that's where we sat. So
Mhm,
many women sit in
mhm.
that.
Yes, I
And what
did.
that the defects, you are a defect and
Mhm.
there's more to the story. And we just didn't have enough of it to be able to look at it a different way or to get curious about it.
You know what's
Yeah.
interesting is how many times I went to the lactation consultants were in the hospital, right?
Mhm.
How many visits I had with
Oh,
them, how many times, and I feel bad for my husband again because he went with me every single time, and
yeah.
how many times I was so defeated and so sad and so,
Yeah.
crying and all the stuff thinking
Yeah.
that it was a me thing, and
Yeah.
nobody ever asked me about medications. Nobody ever, not even any medication, like,
Yeah.
nobody ever asked, "Are you on anything that might be, oh, that could be it. That could be one of the reasons why you're not producing milk." That would have
Yeah.
made sense to me at least, like, if I woulda
Mhm.
had a rationale or reason,
Right.
otherwise, like, it was me, like,
It was
my
me.
body doesn't do the job of a mom that it should do. Well, that's because it was being blocked,
Right.
by something else, and nobody was talking
Right.
about it, and I was on supplements and all the
All the
same
things. Yep.
stuff, same stuff. "Are you
Tried all
drinking
that.
enough water? Are you doing?"
Yep.
Yes, I'm
Food. I
chugging
did all the
water, like,
food things. I did. I brought
everything.
all that in. Like,
All of it.
I
I
got
had an
inquisitive with that,
industrial
but
pump. I had this industrial giant pump that I would literally sit around all day without a shirt on, hooked up to this pump as much as
mhm.
I could, and
Yep.
I would get an ounce and a half by the end of the
Oh,
day, okay? And then my son wasn't even drinking it because he was a sluggish feeder, so
yeah.
all of these things, and, the sluggish feeding was part of it, was part of the SSRI. I'm sure the milk production
Sure.
was part of it, the lack of milk production was part of it as well.
Yeah.
So, all of these things just kind of made this a disastrous, postpartum mom shame, guilt, you know, problem,
Yeah.
So, and again, are we in Groundhog's Day? Because I feel like there's so many women that are still going through the same type of suffering, and children who are going through the same type of suffering,
Mhm.
because this is not being talked about in a realistic, research based way.
Mhm.
And this will be the hill that I'll die on. I think it's just because practitioners are so afraid of non-compliance, and I really do believe that we underestimate the information that somebody who is in a state of mind can handle,
Yeah.
right? Which
Yeah.
is really fascinating to me, because all the people, not all, but the majority of people being prescribed a typical antidepressant or is going to work every day. They're managing families, they're making decisions all the
Mhm.
time. Except
Yes.
this one decision, they are too fragile and too much of a fragile
Yes.
state to make this one decision about
Yes.
a medication that they put in their body. I do not get it. I don't
And
understand it.
And you'll see people in their darkest hour, right? I'm
Mhm.
in there and I am in tears. I'm shaking. I'm all the things, right? I had all those things because I was so upset by what was happening and I could not care for my child in the way that freaking
Mhm.
evolution says I need to, which
Right.
it makes sense, right? Like I could not do it. And that conversation though, even though it would have been so hard to look at me and say, you know what, Jen,
It's probably this.
it could very well be these things. Would you ever consider looking at these things? Even the Lexapro, right? Because yes, I'm in tears. I'm hyperventilating. I'm crying. I'm shaking. I'm in my lowest point. But you know what? I think back, you and I, where we in our professions we are in, right? I consider it a disservice to a client when I am with someone falling apart in front of me
Mhm.
and I don't say to them, you know, did you think about this?
Yes.
Or have you thought about this? Even though this is really controversial, right? Even though it's super controversial, and I'm almost calling something out on the carpet that is close to them, I will still call it on the carpet because they just consider it. It's worth it, and I don't care how distressed you are because I know when you're done, that piece of information, it
Mhm.
does matter. It truly does. And if you don't want it to matter and you're going to let it go, that's cool. But
Fine, but I
that's
feel
what
like
it's
I have to
about.
give it to you, like, I
That's
feel like
what it's
I
about.
have to have the
That's
conversation.
that
What
is that
you
is what
choose
it's
to
about.
do yeah, what you choose to
Yep.
do with the information that you receive
Yeah.
is your choice, and I cannot treat you like you are too feeble,
Right.
right,
Right.
or infirm to handle these conversations
Yeah.
when you go about your day and have a job and a family and all these things, and you're making all
Mhm.
these decisions every single day, except
Yeah.
I believe you can't make this one if I give you all the information. What the holy fuck is that? Like, what kind of thinking is that? We can't treat everybody as if they should be in a psych ward because they cannot handle or they need to have a
Right.
court order for medication because they can't make their own decisions. That's
Right.
not the majority of the population that's on
Right.
these things, you know? So
Right.
these conversations are so heavy and so difficult, um, but so necessary at the very same time.
Yeah.
I didn't realize that you had trouble with the breastfeeding part either. That's
Oh,
something
yeah.
that you and I have not talked about. So
Yeah,
you
we
probably
yep.
didn't realize
For
it for
sure.
me either when I was talking about it. Like, again, 2
Yeah.
different people. Jen and I are 13 years apart, something like that.
Just
We're
about. Yep.
yeah,
14 almost.
13
Yep.
yeah,
Mhm.
13, 14 years apart.
Mhm.
And yet we have had the same or very similar experiences on psychiatric medication through pregnancy and without. So to
Yeah.
me, that is not a coincidental thing. To me, that means there are more of us out there
Mhm.
and we need to keep talking. And I really do feel like, if you are wanting to get pregnant, you need to start having these conversations well before the pregnancy.
Yep.
And by the way, there's no such thing as a preventative SSRI.
Yeah, isn't that something, huh? You better add that on there right at the end
Yeah,
here because that's important. But that's
so weird.
I want to add right here at the end, and then we close here because we're hitting a long time here.
Mhm.
I really appreciate anybody that took the time that is in a position, whether you are a physician, whether you are a counselor, whether you are a nurse practitioner, right, medical doctor, whatever it is, a
Consumer.
consumer. You
Mhm.
are a consumer. Um, you're just a mom, okay? Any and all between actually listening to this. Um, and because it matters for so many people. And so I appreciate you sitting through it and actually maybe sitting in it and just allowing yourself to even like to sit through it as something because you get thrown a lot of stuff at you that might feel really uncomfortable or you get irritable or someone is challenging your degree or your specialties or your knowledge or your role as a mom or all these things, right? But I appreciate people that sat through this and are willing to just sit in it for a hot fucking second and
Mhm.
just get curious about it, because that is what the gaslit truth is all about, is allowing yourself to be in a different space to go, I might, maybe this matters.
Yeah,
Maybe it does. Maybe
maybe
it
it doesn't.
doesn't. But you
Yeah,
know what? I'm willing to sit in it and look at it for a minute. So
100%. So, as long as you're here, please like, follow, subscribe,
yeah.
and comment, at the Gaslit Truth Podcast. You can find us on Spotify, Apple, anywhere you listen to podcasts,
Yeah.
and Instagram, YouTube, Facebook will be there too. So if you want to see our faces, head over to YouTube.
Yeah.
Yes, and we would love to hear your gaslit stories by sending us an email at thegaslittruthpodcast@gmail.com. You can find Jen and I on social media, wherever you look at social media. We will link all of that into our show notes on YouTube and on our podcast. So thanks again for joining us for this hard,
Yeah.
hard, but necessary conversation.
Thanks, everybody.